Hello, I'm Dr. Patrice Berry, and here I share educational videos on a variety of topics. Today, I wanted to talk about some myths about adoption, what adoption looks like, and then 7 core issues that often come up with adoption. So one of the first myths about adoption is that adopting an infant, or the younger the child, the less issues that you'll have. And while older children need different support and they may have some ingrained patterns that are problematic, younger children may still experience a lot of the 7 issues that I'll discuss later, and it can impact even growing up with their adoptive family all of their life, never having known their birth family. They may still have a lot of the things that I'll be talking about later. Often families are confused about this and they don't understand, but why are they having issues? Why isn't our love enough? And it's not that the adoptive family's love isn't enough. It's that there's a part of the child that they're trying to understand and that they're having some questions about, and partnering with an adoption competent therapist can be really important. And the reason why I specify an adoption competent therapist is because not every therapist is going to give you sound advice when it comes to your family, the unique needs of your family. I recently completed an adoption competency and it opened my mind, and that's where I'm sharing some of the information that I now share with families that I learned by understanding the grief and the loss and addressing some of the things that we'll talk about a little bit later. Another myth that people often have is that their family and their love will undo all of the negative things that a person experienced. And while the more stable and secure the adoptive family is, there's something called perceived threat, and safety has to be felt. In trust-based relational intervention, I will link some resources about that below, but within that program, they talk about felt safety, having the child feel safe, because a person can physically be safe and not feel safe. So right now within my home, if I'm thinking, oh my gosh, well, what if that happens? And what if this happens? And what if that person comes through there? And what if my brain is going to respond as though there is currently a threat in this room, even though there is no threat. And I am 100% safe in this moment right now. And so once again, often families do partner with a therapist to help work through some of these issues. And I look at it as a system, as a family issue. I don't see the child as the only problem, because often what can happen, the child may be very good at triggering the parents, and the parents may then respond in a way that just creates this problematic dynamic. And so being able to do really good family work and address the family dynamic, I think, is really important. And if you're considering adoption, making sure that you've healed those spaces and that you may need to go back for your own therapy along the way when there are times that things are being triggered. The child is saying, you're not my real parent, or you're not, the child will say and do things that causes the parent to want to push them away. The thing with an adoptive child is pushing them away breaks that attachment. And attachment is so important. I can't get into attachment all within this video. I'm trying to make it short, but looking into attachment styles and attachment and how does your child connect can be really important, because often the love I give has to also be felt. And so there are a lot of kids that, because of their own experiences, because of their own thoughts about themselves, they struggle with being loved unconditionally. Parents have to be very careful about the types of things that they say. So adoptive families can never say things like, if you don't get it together, I'm going to send you back, or you're going to be out of here. Because this child actually did have somebody give them up or lose custody of them at some point. And so that triggers that attachment loss. And in my experience, I've been doing this for a very long time. Their behavior, if it does improve, it's for like a week or two, maybe a month. It doesn't improve long term. That really, those types of threats they don't change anything. So I really encourage families that if they are looking at relinquishing custody, or if they are looking at getting additional respite or seeing what other services are available for them, that they do that research and don't say anything or don't talk about out-of-home placements until it's for sure that, yes, this is what we're going to do. Because behaviors typically increase. And I've seen a lot of kids self-sabotage and do things. They want to be with their family, and at the same time, there's a part of them that's not trusting it. And they may do things to kind of re-traumatize themselves or kind of bring things back up, and work with the school to have accommodations there if that's what's needed. Because I've had a lot of kids where things were triggered at school that then came home, or that things are going on at home and then they migrate to school. And so making sure that everyone within the support team is communicating, and that the family, that they never say anything negative about the birth family. And when it is appropriate to give the child difficult information about their birth family, sometimes doing that with a therapist can be helpful, or doing it close to a therapy session just in case there is a major escalation. So adoption can look very different. Adoption can be a family member taking care of a child while a parent is unavailable due to mental health or due to a variety of reasons. Sometimes that includes getting legal custody of the child and legally adopting the child. Sometimes it's the family member getting medical power of attorney. The interesting thing with only having medical power of attorney is that often the family member may struggle to get certain services because they need the birth parent there. If hospitals, doctors, therapists are trying to minimize any risk, sometimes they do want a legal guardian involved, which can be very frustrating for the family that's raising the child. There are international adoptions, and then there are kids that are adopted through foster care. And each one of those different types of adoption comes with their own strengths, things that make it great, and then things that you just want to consider, some special considerations. So adapted from the work of Silverman and Kaplan, there are 7 core issues related to adoption. And the first one is loss. And everyone within the adoption kinship network, the birth family is experiencing loss. The adoptive family is actually experiencing the loss of this child never being their birth child, and having to always explain at doctor's appointments or at different times the adoption story. And then the child experiences loss as well. There are lots of things gained in adoption, but right now I'm going to focus on the clinical considerations that often come up. There's rejection that's often experienced by the adoptive family, the birth family, and then also the child as well. Rejection can be huge, and the child may question why they're not with their birth family. And even older children that are aware of some of the abuse and things, they still sometimes struggle with the rejection. There can be a lot of guilt and shame that's related to adoption. Kids can sometimes feel that they deserved to lose their birth family or that they did something wrong. And within my clinical work, I often ask kids that are in foster care or that have been adopted, what's their understanding of how they came into care or why they came into care, just to kind of hear their perspective on things. And I also tend to ask if there was a history of abuse, who told, or how did people find out that something wasn't okay? And it's very common, especially with neglect, that people think, oh, it was fine that my parents never supervised me, that we were running in traffic, or the kids sometimes don't understand what appropriate parenting looks like, and they may not view what they went through as abuse. And it's not the adoptive family's job, because often what I've seen is that if the adoptive family tries to help them understand that, hey, this isn't okay, the child often gets mad at them. Often bringing in a therapist can help, because that's a neutral person. Identity, especially in those teenage years, preteen, teenage years, the child trying to figure out, who am I? And a special note for cross-cultural adoptions, that having that child connect with their culture, with their birth culture, is extremely important. That they take a piece of that with them, that they continue to carry that with them, and that they're exposed to members of the community, of their birth family, of their birth culture, because culture is learned. And that child is going to have the culture of their adoptive family. They just are. There's also going to be that culture that they would have been born into, or for older children that they were born into. And within the adoption competency, we talked about little things like if it's an older child and the birth family was really into the Cowboys, but this family, their adoptive family, is really their New York Giants fans. Well, now, because of their family growing, now the adoptive family saying, because we love you so much, we're going to cheer for the Cowboys. That can go a really long way in helping normalize a situation that for a child, somebody who does not have a fully developed brain, and if they've experienced significant trauma and neglect, they often have significant gaps in memory processing, possibly. Like their brain may not work the way that it's supposed to. And that's another reason why I really encourage people to look at it that the child may be doing the best they can. And I will link some really great resources below that can help, along with finding that adoption competent therapist. Intimacy. Many kids that are adopted, at times they may struggle with intimacy. Some kids don't. The family, the birth family, may struggle with not wanting connection, even if it's allowed, because there are times when connection is allowed, but the birth family it's too painful to stay connected, and so they don't. And for the adoptive family, sometimes connecting with a child that may be saying very hurtful things, that may have very significant behaviors, that can sometimes cause an issue. So sometimes intimacy can be an issue, and they may have to develop some appropriate boundaries around intimacy if there have been violations. And then the last one is mastery and control. This is a big one, and I really like the work of Karyn Purvis through TBRI, where they talk about giving the child appropriate control. So let's not fight battles over this t-shirt because I really want you to wear this t-shirt. Let's not fight that battle. Let's not fight battles over eating one specific thing. Let's pick and choose, and then also give that child some sense of control while the adult keeping their appropriate levels of control. And one of the things that they recommend is having a yes table. Food is often a major struggle for kids that have been adopted, especially 2 years old and older, and controlling food. And it's so common that the parent is cooking dinner and the child comes up and they're putting it on the plate. Like they're about to sit down and eat, and the child asks for an apple. And the parent, of course, they're going to say, no, can't you see? Your food is right here. Please just eat your dinner. And so instead of saying no in that situation, the word no triggers a child's mind and can trigger that sense of I'm not safe, just like a bear chasing them. Like the same parts of the brain activate for the word no. And so that's why they recommend having a yes table where there are some healthy snacks, some healthy things where the child knows no matter what time of day, if I ask for this, the answer is going to be yes. And there may be a condition. So if I'm putting dinner on the table and the child says, can I have an apple? I say, yes, go on ahead and put it at your spot, and you can have it after you finish your dinner. Yes, and that being something that can often help break some of those power struggles. It may not work for every person, but just kind of tweaking some little things and working with somebody that can work with your family to have you all have some joy and love and hope, and to help that child cope and manage some of the thoughts and feelings that they're having that are very normal. I will also make a special note that sometimes kids have picked up things along the way that worked for them in an unsafe environment. And those behaviors are very difficult to let go of in a new environment. And so I heard somebody say, if you're adopting a 12-year-old, it's almost like you're coming in at chapter 12. And you may not have a really good idea of what happened in those first 11 chapters. And just to be prepared that it will take time to change some of those behaviors, to have them let go of some of these things, that 1 year and the scope of their lifetime actually isn't that long. And so working with adoptive families and working with people that are going through their own treatment as a birth parent that lost custody of their child, or with adopted children, even adults. Those 7 things that I mentioned, they don't just affect children. They can affect people who are adults, or as they start to have their own family, it might trigger some things. And so connecting with a really good therapist can be really helpful. And so I will link some resources that I typically give out, and I hope you enjoy the rest of your day.